Hello students, welcome to the YouTube channel of Careers 360. So in India, most students and even parents, they have been obsessed about engineering and medicine since decades. Now, when it comes to engineering, every year around 15 lakh students appear for IIT JEE. Most of them are competing for around 60,000 seats across IITs and NITs. Now the good part is, even if they don't get into any of the IIT or NIT, there are still a lot of good colleges are there in the private sector. A lot of, in fact, thousands of seats remain vacant at the private engineering institutions. In contrast, in case of medicine, more than 20 lakh students, in fact in 2025, more than 22 lakh students appeared for NEET, NEET UG. They were competing for around 1,30,000 seats for MBBS and BDS. Now, unfortunately, more than 20 lakh students are left without any option. In most cases, students को पता ही नहीं होता कि अच्छा medicine नहीं हुआ, MBBS या BDS नहीं मिलेगा, अब क्या करें? So, is there any solution? If you have got any questions, please put them down in the comment section. We'll definitely get back to you. Unfortunately, what we fail to realize that the healthcare system is more than just about doctors. Of course, doctors are needed, but you also need other professionals, just like nurses, pharmacists, lab technicians. Altogether, they are termed as paramedicals or paramedics, but professionally I would use the term allied and healthcare professionals. If we look at the data, currently there are 8.4 allied health professionals in India per 10,000 population. Whereas if we look at the WHO guidelines and some of the survey reports by BCG, KPMG, we need at least 14 to 16 allied and healthcare professionals per 10,000 population in India. And when we extrapolate that data, it's even amusing. By 2030, India will face a shortage of more than 6.5 million allied and healthcare professionals. That is a huge number. If you are passionate about biology, if you are really passionate about serving the healthcare sector, I think allied and healthcare courses are really something you should consider in 2026. I think it's a big time that you should think beyond MBBS and BDS. If you love biology, if you are passionate about healthcare, if you want to serve the society, I think allied and healthcare sector is definitely something to consider and look forward to in 2026. Before we move on to the next stage, if you have got any queries regarding medical and allied sciences, please put them down on the comment section or send us hi on WhatsApp on the number given below on your screen. Now, we will look at the key reasons why you should consider allied and healthcare courses in 2026. Number 1. Rising demand. With the prevalence of increasing lifestyle diseases, increasing aging population, the complexity of our lifestyle, our routine, our diet, we're living in the AI age, fast food, fast delivery, everything. And of course, expanding healthcare system. You are seeing a huge increase in the number of diagnostic labs, even private clinics and hospitals. So obviously we'll need experienced and skilled technicians and therapists. Number 2, shorter duration. Unlike MBBS or BDS, which is a 5.5 year course, most of the allied and healthcare courses are 2 to 4 years in duration. That means you'll get into the job market much quicker. You'll get exposed to clinical training much quicker. You'll get exposed to variety of specializations. Number 3, affordability. If you're attending a government medical college, cost will be definitely on the lower side. But if you end up in a private medical college, the cost might go beyond 1 crore, even 2 crores. On the other hand, if you are pursuing an allied and healthcare course, even at a private institute, it's not going to be that expensive. Max 6 lakhs, 8 lakhs, on the top 10 lakhs for 2 to 4 years program. These courses are much more affordable when you compare to any MBBS or BDS course at a private institution in India. Number 4, diverse career specializations. Depending on your area of interest, you can choose from radiology and imaging technology, or medical lab technology, or physiotherapy, or optometry, or even dialysis technology. Or you can also get into something like, say, anesthesia technology or operation theatre technology. Or even better, you might combine them. You can pursue a BSc in anesthesia and operation theatre technology. At the end of the day, during a surgery, apart from the surgeon or physician, you also need a nurse. You also need who can perform the routine surgical procedures, and who can help with the anesthesia procedure. So there is a room for everyone. So you have to get out of that mindset. The healthcare system is only about doctors and in some cases nurses. Sometimes what we don't see, the key personnel who are behind the scenes. Every hospital, every clinic, every diagnostic center, they need allied and healthcare professionals. Moving on to number 5, direct human impact. Through paramedical or allied and healthcare courses, you'll have a great opportunity to serve the mankind, to make better patient outcomes, and to support the physicians and doctors. That will give you a great job satisfaction, and also a sense of purpose. And I think that's a great thing to have. Number 6, government initiatives. In the last few years, the government has taken many initiatives to encourage the healthcare education. Because there is an acute shortage of allied and healthcare professionals, not only in the Tier 1 cities, but throughout India. If you look at Tier 2, Tier 3 or rural areas, the shortage is even more acute. In 2021, the Government of India introduced the National Commission for Allied and Healthcare Professionals Act. They intend to make this sector more professional and to create more career opportunities for the youngsters. So I think it's a great initiative by the government. They have been promoting these courses for a long time, but now since 2021, they have been taking some concrete steps towards that goal. Last but not the least, salaries and global opportunities. For a fresher, the average salary could be in the range of 3 lakhs to 6 lakhs per annum. Secondly, a skilled professional, be a radiologist, be a lab technician, be a physiotherapist. There's a huge shortage not only in India but abroad as well. Countries like US, Australia, Canada, UK, Middle East and Germany, they have been welcoming nurses, doctors and allied healthcare professionals for the last 10-12 years. So if I've got a degree, I've got some experience, maybe 3 to 5 years or 7 years, there are ample opportunities even in foreign countries. So with that, I'll close. I think it's time to look beyond MBBS and BDS. And I think with 2026 approaching, it's the time to consider the allied healthcare courses as a mainstream career, not only as a MBBS or BDS backup. Thank you and good luck.